badly needed help to expand testing in the U.S. is starting to arrive. 500,000 swab kits flown in from Italy are being sent to medical facilities all over the country. Some good news among other glimmers of hope.
We are cautiously optimistic that we are slowing the infection rate.
In New York, the number of ICU patients dropped for the first time. Hospitalizations are flattening out, even though the state itself has more cases than any country outside of the U.S. In Chicago, another hot zone, numbers are dropping there too.
What we're starting to see is a flattening, and we may not actually get the kind of apex or peak that we've been thinking about.
The president says physical distancing is working. So much so, nationwide projection models have shifted. Instead of 100,000 deaths as the best case scenario, it's now closer to 60,000.
In the midst of grief and pain, we're seeing clear signs that our aggressive strategy is saving countless lives.
But the coronavirus task force warns this does not mean restrictions can be eased.
We have not reached the peak. And so every day we need to continue to do what we did yesterday and the week before.
Donald Trump acknowledged reopening the country too quickly could lead to more deaths, and it's weighing on his mind.
I don't know that I've had a bigger decision.
The revised projections don't change what's happening in hard-hit areas. A new military field hospital is now taking coronavirus patients in Detroit. Hundreds of people lined up in their cars in Miami at a drive-through food bank. And there are new tracking measures in Wisconsin to see if any infections are linked to exposure from Wednesday's election.
To help with his biggest decision, the president will unveil a new task force next week, which will focus on how to reopen the country. Katie Simpson, CBC News, Washington.